Psychiatrist Joseph Wolpe was interested in helping individuals with various phobias. Through his research with animals, Wolpe discovered that fear reactions could be reduced by a simple conditioning procedure. For example, suppose a rat behaves fearfully when it sees a realistic photograph of a cat. If the rat is given food every time the cat is presented, the rat will become less and less fearful until the fear response disappears entirely. Since the fear response and the feeding response can't exist at the same time, the fear was inhibited by the feeding response. Wolpe called this incompatibility of two responses reciprocal inhibition. He believed that he could modify this approach for use in people. Wolpe hypothesized that if a response inhibitory to anxiety, such as relaxation, can be made to occur in the presence of anxiety-provoking stimuli, the bond between the stimuli and the anxiety will be weakened. Wolpe treated his patients using his systematic desensitization technique. His technique consisted of 3 stages. Number 1 was relaxation training. Wolpe taught the patient how to relax their entire body. Number 2 was the construction of an anxiety hierarchy list. Wolpe and the patient worked together to develop a list of anxiety-producing situations or scenes involving the patient's phobia. The list begins with low anxiety-producing scenarios and increases accordingly. The final step is the desensitization. Wolpe instructs the patient to relax while he descriptively reads through their anxiety hierarchy list. If at any time the patient begins to feel anxious, Wolpe instructs them to raise their index finger. When this happens, the presentation will stop until they have returned to full relaxation. Wolpe randomly selected 39 of his 150 cases. Success of their therapy was judged by the patient's own reports and by occasional direct observation. Patients who reported improvement and gradual recovery described the process in ways that led Wolpe to deem their reports credible. The desensitization process was rated as either completely successful, partially successful, or unsuccessful. In the 39 cases, there were a total of 68 phobias treated. 62 of these were judged to be completely or partially successful. This was a success rate of 91%. The remaining 6 phobias were unsuccessful. This was a failure rate of 9%. The average number of sessions necessary for successful treatment was 12.3. Critics of Wolpe argued that his methods were only treating the symptoms and not the underlying cause of the anxiety. Critics believed that other symptoms would appear to replace the ones treated in this way. This sparked the question, would the results last? Wolpe responded to criticism by obtaining follow-up reports from 25 of the 35 patients who had received successful desensitization at various times. Wolpe found no reported instance of relapse or new phobias or other neurotic symptoms. Wolpe's study is significant because it showed that we can eliminate phobias through the use of desensitizing techniques. Wolpe's findings have the potential to greatly improve the quality of life of individuals suffering from debilitating phobias if the individuals are willing to undergo treatment.